Welcome back to our channel, which is dedicated to the latest news and untold stories about Catherine, Princess of Wales, and her royal family. Today, we bring you some news. The oncologist unveils a health update on Catherine's chemotherapy treatment. Catherine, the Princess of Wales, has been receiving chemotherapy treatment for a while. The medical team recently delivered a positive report on her development. According to her physicians, Catherine has shown a favorable response to the therapy, demonstrating notable signs of progress. While the adverse effects were difficult, they were controllable, and her ability to recover was commendable. Chemotherapy, sometimes known as chemo, is a long-standing and extensively used method of cancer therapy. Oncologists use chemotherapy agents to eradicate cancerous cells with the goal of achieving cancer remission, managing metastasis, or reducing tumor size to ease symptoms such as pain. These medications function by specifically targeting cells that undergo fast growth and division. Nevertheless, because of its impact on rapidly dividing healthy cells, chemotherapy often results in adverse reactions such as alopecia, emesis, anorexia, hemoglobin deficiency, and increased susceptibility to bleeding. According to a report, the medical professional provides details about Catherine's journey and future prospects. Given Catherine's current state and the anticipated recovery period, we anticipate her gradual return to her royal duties in the upcoming months. If her recovery continues at its current pace, she could potentially begin taking on minor responsibilities by the start of next year. We anticipate that she will fully resume her royal duties by the middle of next year, allowing her ample time to restore her physical well-being and ensure a thorough recuperation. The royal household and the people continue to show their support and anxiously anticipate Catherine's resumption of her responsibilities. Currently, she is primarily concerned with her physical and mental condition, aiming for a complete and rapid restoration of her health. The therapy, while difficult, has shown favorable outcomes, and her medical team maintains a hopeful outlook on her recuperation. Chemotherapy, notwithstanding its adverse reactions, continues to be one of the most successful treatment options for cancer, providing optimism to many patients around the world. As Catherine undergoes her medical treatment, the assistance of her family and the general public will undeniably be important in her recuperation. We eagerly anticipate her resuming her royal responsibilities, having made a complete recovery and being even more resilient than before. The doctor provided an explanation of Princess Catherine's health update during his remarks. The mechanism of action of chemotherapy. Chemotherapy medications function by inhibiting or decelerating the proliferation of cancer cells. These drugs specifically target rapidly proliferating cells. Chemotherapy treatment, unlike surgical procedures or radiation treatments, can affect the entire body. This systematic technique enables chemotherapy to specifically target cancer cells that may have metastasized to other regions of the body.
However, it also results in a potential impact on rapidly dividing healthy cells, which include those found in the skin, hair, intestines, and bloodstream.
The chronology of chemotherapy. The duration of recovery from chemotherapy adverse effects is variable. Typically, the recovery period for treatment with chemotherapy lasts approximately 2 months for every 1 month of treatment. Following this phase, patients often experience a restoration of their vitality and start to feel a sense of normalcy returning. The symptoms of sickness and vomiting may persist for a duration of 2-3 weeks after the conclusion of the previous medical session. The duration of chemotherapy sessions may vary from 3 to 6 months, depending on factors such as the type and stage of cancer and the number of individual medications administered. Patients often endure many treatment phases, each lasting 2 to 6 weeks, interspersed with periods of relaxation to facilitate the body's recovery and the production of healthy cells. Evaluating the efficacy of chemotherapy. Many methodologies, such as physical examinations, hematological analyses, imaging techniques like MRI or CT scanning, and tumor biomarker assays, evaluate the efficacy of chemotherapy. Indications of chemo's effectiveness include fewer side effects, reduced lymphatic system inflammation, and improved energy levels. On the other hand, if a tumor grows larger or cancer spreads while undergoing treatment, it suggests that the chemo is not having the desired effect. Physical exam. During an actual examination, physicians assess if palpable lymphatic vessels or tumors have reduced in size. Blood tests, such as a full blood count, assess the levels of red blood cells, white blood cells, and platelets in the bloodstream. Imaging studies, such as MRI or CT scans, enable clinicians to visually assess the size, growth, and metastasis of cancerous tumors inside the body. Tumor marker tests quantify the quantity of cancer cells present in the bloodstream, tissues, feces, and other bodily fluids. Adverse effects and rehabilitation. As previously stated, chemotherapy may induce significant adverse reactions. The duration of these negative effects is determined by your chemotherapy regimen, which includes the drugs used and the number of treatment cycles undergone. The recovery period for chemotherapy treatment typically lasts around 2 months for each and every month of the recommended treatment.
However, it may vary for each patient.
Currently, you should have restored vitality, indicating a return to your previous state. Chemotherapy-induced nausea and vomiting may persist for 2 to 3 weeks following the last treatment session. Challenges that may arise during chemotherapy. If cancerous cells fail to react to treatment with chemotherapy, it may result in tumor growth rather than reduction, metastasis of cancer to other body sites, and the recurrence or worsening of cancer symptoms. Regrettably, cancer has the potential to metastasize while undergoing chemotherapy. Although chemotherapy is a very effective method for treating cancer, it does not guarantee success in every case. The dissemination of malignancy any time after or during the chemotherapy session might indicate tumor progression. Alternatively, it might indicate that while the initial tumor has decreased in size, the cancer has disseminated to other parts of the human body, a phenomenon known as metastases. Thank you for seeing the video. Kindly share your opinions and farewell for now.